And then we moved down to Palm Springs, where we live, in the Palm Springs area, Rancho Mirage, where we live now. 3 is about to rocket off the launch pad all over the world. This is the time for you to seriously look at this. If you are looking to improve your health, and that's the number one thing, improve your health. And that's what this is all about. Because as you've heard, this is a great business vehicle, but the reason it works is because of these products. It's a product-driven company. If the products were garbage, this thing would be falling apart. The products are spectacular, as we'll get into in a minute. And this is going to basically change your life individually if you use these products. But in addition, it's going to change your social interactions with people if you can help them to get healthy. So we are nothing more than just talking the story, spreading the word, sharing the knowledge about these products. My good friend Sally called me up in San Francisco. She's in San Francisco. She calls me up and she says, hey, you got to look at this company called 3. Now, I'm a board certified internal medicine physician who's been practicing I'm 79 years young right now, and I've been practicing about 50 years in internal medicine, still practicing down in Southern California. And I have always been, I went to Tufts Medical School in Boston, which is a very good school, then to Albert Einstein College of Medicine in New York City for further training, then out to Case Western Reserve University for further training. So I'm in what they have been in academic training, good quality places, and I'm board certified in internal medicine, and I've always been open to proactive wellness. In other words, using vitamins, supplements, meditation, homeopathics, Zen, any kind of non-medical, non-pharmaceutical, non-prescription treatment for patients to see if they can get better without me having to write a prescription for a pharmaceutical agent that's got tons of side effects. You know, I chuckle every time I watch the tube and they come out with a new drug for something. Skyrizi, which is going to be great for your psoriasis if you have it. And then underneath in small print, may cause liver failure, kidney failure, death, heart, or the announcer, as the actors are going like this, the announcer is talking about death and dialysis and this and that. Pharmaceutical drugs work, but they're loaded with potential side effects. So as I love to tell my patients and my family, if you can get on something natural and you can get good results from it and perhaps avoid having to take prescription drugs, or if you're a diabetic or a hypertensive or you have high cholesterol and you're already on insulin or other agents or statins or things or antihypertensive medication, and these products can help you in terms of to get better numbers, lower your A1C. For those of you that don't know what that is, it's the blood test we use to follow diabetics, A1C. If it'll lower your blood pressure, if it'll get your cholesterol down, it's basically a home run. So that's what I've been doing for 50 years. I've been starting out in practice by telling patients, now listen, before we put you on a statin, before we put you on something to lower your blood sugar that's going to be a pharmaceutical, let's try something natural. We'll give it 30 days, we'll give it 60 days. If it works, great. If it doesn't work, I can always put you on prescription drugs. So I've had that mindset for a while. So people call me all the time and say, hey, I've got this great company, MLM company, multi-level marketing company, it's making great products, so why don't you take a look at it? And what I love to say is, show me the studies. And I know that's going to end the conversation because 99% of the companies out there in the health field don't have good studies to show that their stuff really does what it says it does. Let's go back to Consumer Reports. You probably all know about Consumer Reports. Periodically, they analyze supplements, vitamins, things like that that are sold in the open marketplace, over-the-counter kinds of stuff. And they look carefully at what's in the product, and very often it's nowhere near what the manufacturer says is on the label. It's either much weaker, or it's much stronger, or it's almost absent. So you gotta really be careful about what kinds of things you put in your body. Now, advertising will do it. You know, Centrum, one a day. My God, they probably sell billions of that stuff. I have no idea about the quality of that stuff other than what the announcer says. I don't know if there's any clinical studies available for people to see. So Sally calls me up and says, look at this company. And I said, show me the studies. And she said, sure, no problem. And I went, what? There are studies? And I started looking at what Dr. Dan Gubler, who is the PhD organic chemist, Caltech trained, published, a voice in the industry in terms of creating formulas that work, that are natural. He's got studies. So I looked at those studies for a couple of days, and then I called up Sally and I said, okay, I'm ready to join. And she said, don't you want to start don't you want to try the products? And I said, I don't have to. This is the only company I've seen, and I've seen a lot, where they actually have published studies and third-party studies. What does that mean? That means Dr. Dan's done the research, and then he sends all of his data to an independent outside lab and says, hey, why don't you repeat the whole thing and see if you get the same results? Third-party, clinically verified. That's huge. So that got my interest. And this is even before I tried any one of the products. So what's happened over the last year for me is now I am taking all of these products, and I have never felt as good as I do now, in spite of the fact that I'm 79 and in spite of the fact that I have cancer. I have a cancer called multiple myeloma. It's a bone marrow cancer. And basically what's happened is I am getting immunotherapy, not chemotherapy, immunotherapy every month at Cedars-Sinai in LA. And thank goodness my cancer is now in remission. But every month when I go to see my oncologist, he says to me, Green, you are the most active, spry, alert, 79-year-old patient I've got in my entire practice. Wow. And I keep saying to him, Dr. Berenson, you got to go on these products. These are unbelievable. They won't cure cancer, but look, I'm a walking testimonial for what they'll do for you. And typical of physicians who are of a certain headset, we'll talk about that in a minute. No, they're not FDA approved. Okay? You have to understand that in this country, the FDA, the Food and Drug Administration, approves certain products that we ingest, that we take, and right now all they look at is what are called pharmaceutical products, which means big pharma, the drugs. That's what they're doing. And they are running ragged trying to keep up with all the drugs that are coming out in terms of trying to find if there are any problems with those. So they don't look at natural products like vitamins and supplements at all. They haven't. So a while back, Congress got this concept of that nutritional companies like ours, by the way, we're one of maybe 1,000 in this country alone, maybe 5,000 around the world, who are making supplements and vitamins and minerals, things like we make. So what happens here is that the FDA doesn't look at it, so Congress decided we're going to regulate it to some degree, and a label came out as GRAS, G-R-A-S, generally regarded as safe. So let's get back to Consumer Reports, because a lot of manufacturers of supplements and minerals will say, our products are good. Centrum, we're good, we're GRAS, generally regarded as safe. And then Consumer Reports drills down and does an analysis of what's really in each of these products and find out that there's worlds difference very often between what the pharmaceutical company says and what's in reality. So you can't go on the basis of that. But when Dr. Berenson says to me, they're not FDA approved, I say to him, sure, there's no company that has FDA approved vitamins and supplements, because that's not what the FDA does. However, the thing that makes us stand out, three international, is we are a company that have all of our products, and we only have 11. We have them all manufactured here in the United States. We have them all manufactured from individual components that are FDA approved, but more importantly, they're manufactured in what are called FDA regulated manufacturing plants that use GMP, actually it's GMPC, good manufacturing processes that are certified by the FDA. So even though the FDA doesn't put a stamp of approval on our products, the fact that we can brag about the fact that we're made in FDA-approved facilities using GMP is huge. And it's just another testament to the quality. That's just the beginning. As Samson said, there's 650,000 species of plants, and only 5% of them have been looked at in terms of medicinal kinds of value. And Dr. Dan is a real nerd. And for those of you that don't know what a nerd is somebody that says, leave me alone, I just want to do my research, I want to do my science, I'm happy, I don't want to deal with the world, I just want to do my thing. And his thing is molecules. So he runs all over the world looking for molecules to bring back to his lab. And then he puts them through all products that he thinks are going to be good, and he puts them through all kinds of analysis. And then he's got this thing which we'll talk about more over at my table, which is called the Wellness Table. This is the business hub. I'm going to run on the Wellness Hub. And he basically puts them into what's called cellular absorption technology. And what that means is basically they get absorbed into your body quicker. And we'll go into the details later. But here's the real value of that. So if you take Revive, or you take Vitalite, or you take Eternal, or Collagen, any one of the products that you take, it's going to get into your bloodstream, more importantly into your cells, more importantly into the mitochondria in your cells where energy is made much, much quicker. So what does that mean? That means when somebody says to me, I want to try the product, I know because of cellular absorption technology, that person's probably going to come back within 3 weeks, maybe a month and say, wow, I want more. And that's the key. You want to basically introduce this to people, let them experience it. Hopefully they're going to have the kind of good experiences that everybody in this room has had. And then what they're going to do is come back for more. Then there's a whole bunch more stuff I'm going to share with you at the table about why these products are so much better than anything else out there. But again, to summarize, because I get excited about it and could go on for hours about this, as you can see. To summarize, it's the products that run the company. $200 million in sales in about 2 years. You know, when I talk to business people and I say I'm working with a startup and it's brand new, it's only about 2.5 years old now, and in the first 2 years they did about 200 million, heads turn. Because if you ask any business person, how fast is that growing? You know, I don't think Amazon or Google or any of them grew from 0 to 200 million in the first 2 years.
Yeah, that's like unheard of.
It's unheard of. And the reason, again, is because of the products. So as you look at this, if you decide for whatever reason that the business is not for you, think about taking the products because they really will change your life. Thank you.
Thank you.